So many people know the rumors. Very few know the real story. For more than a century, this land held one of Michigan's most important institutions. Pontiac State Hospital, later known as the Clinton Valley Center, was a place built with confidence, authority, and belief in progress. Today, none of it remains, but the story still matters. And tonight, we're telling it. Welcome back to Pontiac Pulse, where we explore the past, present, and future of one of Michigan's most historic cities. I'm Chris Hubel with History Loves Company. Today, we're stepping into the full history of an institution that once dominated Pontiac's landscape, its workforce, and its identity. Pontiac State Hospital, later renamed the Clinton Valley Center. To understand why this place existed, we have to go back to the mid-1800s. Michigan, like much of the country, was facing a crisis in mental health care. The state's first asylum, in Kalamazoo, was overcrowded almost as soon as it opened. People suffering from mental illness were being confined in jails, poorhouses, or left without care altogether. Reformers believed that this was unacceptable. They pushed for a new institution, one that reflected the belief that environment could improve lives. Not punishment, not isolation, but treatment. When Michigan authorized a second state asylum, cities across the eastern part of the state were invited to bid. Pontiac made its case. It had rail access, available land, room to expand, and a city leadership eager to host a major state institution. In 1878, the Eastern Michigan Asylum for the Insane opened here. This wasn't something hidden out in the outskirts. It was intentionally prominent, a civic statement. The original hospital was designed by Elijah E. Myers, one of the most important architects in Michigan history. Myers also designed the Michigan State Capitol in Lansing and multiple state capitol buildings across the country. This matters because it tells us something important. This hospital was meant to project authority. It was meant to look permanent, official, serious. This wasn't a temporary solution. It was architecture backed by policy. The hospital's layout reflected ideas popularized by Dr. Thomas Story Kirkbride, a physician whose theories shaped psychiatric architecture nationwide. Kirkbride believed that architecture itself could influence mental health. Buildings should be orderly, symmetrical, predictable. Wards were arranged to maximize light and ventilation. Windows were large and frequent. Long corridors reinforced routine and structure. The belief was simple: a calm environment could calm the mind. Pontiac State Hospital followed these principles closely. The hospital didn't stay frozen in 1878. It grew, expanded, adapted. Major additions were built in 1882 and 1895, designed to blend seamlessly with the original structure. In the early 1900s, new brick wings were added in 1906 and 1914. In 1938, a Tudor-style building joined the campus, and one of the most striking structures, an Italian Renaissance-style chapel, was designed by Smith, Hinchman, and Grillis, one of Detroit's most influential architectural firms. This wasn't a patchwork campus. It was a carefully curated one. At its height, Pontiac State Hospital was massive. More than 3,000 residents lived here in the 1950s. But this wasn't just a hospital. It was a self-contained city. There were patient wards, administrative buildings, staff housing, power plants, kitchens, laundries, workshops, farms. Food was grown on site. Clothing was produced internally. Patients worked. Staff lived nearby. Routine governed everything. For generations, this institution was one of Pontiac's largest employers. Doctors, nurses, orderlies, maintenance workers, tradespeople, farm laborers. Entire families moved to Pontiac because of this hospital. Neighborhoods formed, transit routes expanded. Local businesses relied on hospital payrolls. Pontiac didn't just coexist with this place. It grew because of it. In 1911, the facility was renamed Pontiac State Hospital. By the 1970s, patient numbers had declined dramatically as mental health care shifted toward community-based treatment. In 1973, it became the Clinton Valley Center. By the 1990s, only a few hundred patients remained. And in 1997, the institution closed permanently. What followed was uncertainty. For several years after closure, the campus sat abandoned. And this part is personal. When I was younger, I explored the abandoned facility myself, walking through endless hallways, paint peeling from walls, broken windows letting in cold air. It wasn't thrilling, it was sobering. You could feel that this place once operated with precision, routine, and authority, and then stopped. Exploring it wasn't about adrenaline. It was about witnessing the quiet after an institution disappears. Once the buildings were abandoned, stories multiplied. Secret tunnels, hidden experiments, dark legends. Here's what history tells us. Yes, there were tunnels, utility corridors, steam tunnels, service passageways. That's normal for a campus this size. No, it was not an underground city. The truth is more complex, more human. There were people helped here. There were people failed here. Both can be true. Despite its historic designation and listing on the National Register of Historic Places, the entire facility was demolished in 2000. Today, a residential neighborhood called Stonegate Point sits on the former hospital ground. Homes, streets, families living on land that once housed thousands. Most residents have no idea what stood there before. Pontiac State Hospital forces us to confront difficult questions. How do we care for vulnerable people? What role should institutions play? And how do we remember places that shaped lives even after they're gone? Buildings can disappear, but impact doesn't. Pontiac State Hospital, later the Clinton Valley Center, wasn't just a hospital. It was power, it was care, it was control, and it was a mirror of the era that built it. I'm Chris Hubel with History Loves Company, and this has been Pontiac Pulse. Every city has a history. Pontiac's deserves to be understood.